vaginal rejuvenation. I'm just coming right out and saying it right off the bat so that you don't have to be embarrassed or you don't have to be shy, because this is a medical procedure and we are lucky enough to have a doctor who is an expert in this area that can answer all of your questions about vaginal rejuvenation. This is Dr. Saqib Ahmad. Hi.
Hi.
Thank you for joining us.
Thank you.
What is this kind of surgery?
So it's basically a vaginal laser surgery, and can be explained as the most private makeover for any of the ladies in our community. And what it means is we went back and talked to all the ladies what essentially they wanted. And they wanted us as a physicians to listen to them and understand their needs. They wanted to regain the functionality of the vaginal tone and tightness after they had gone through the vaginal births for their babies, and to have aesthetically pleasing vulvar structures. So for that, we came up with this idea of the laser vaginal rejuvenation, which is essentially a surgery which help you with multiple things on your vulvar and internal and external genital structures.
So we hear a lot about, and you'll see it on TV shows, people doing Kegel exercises. Basically this procedure is going to tighten you up.
Yeah, so there are essentially what we're doing is there are two different parts. One is comes under the heading of laser vaginal rejuvenation, and the other one comes under designer laser vaginoplasty. Now, when we talk about LVR, which is a laser vaginal rejuvenation, we are talking indeed about the tightening the muscles in 5 different directions. So because if you use this model, we have the upper vagina here, we have a lower vagina, the side walls, and then the outside, the perineal muscles. So essentially what it comes down to understand that the female sexual gratification is directly related to the frictional forces generated. So for that, the LVR not only does that, but also bring the youthfulness of the vulva back. How we do that? After tightening these muscles, we make this introitus look more like a slit from the gapping introitus, which essentially can happen after the delivery. We also build the labia majora and minora back to meet in the midline, build the perineal body down here. And by doing that, we bring out the youthfulness function and the pleasing aesthetically aspect of the external genitalia.
Now, if you want to have this procedure done, there's only a few people even in the entire state that are really as qualified.
Right. What it is it has a background story to it. It all came from Dr. David Matlock, who is practicing currently in Beverly Hills, California, and I think a lot of people know him under Dr. 90210. And he essentially invented this technique, and this technique helped thousands of women since he has started using this, and he started this in 1996. And then he established this institute, which he named as a LVR Institute of America. And that institute has approximately, I would say, around 300 to 400 physicians have been trained from that institute, almost around 40 countries all over the world. So he is well known for this procedure and the techniques he used. In Genesee County, I'd be the only one at this point who has trained under that institute with him, along with 2 or 3 more physicians all over the Michigan.
So I do have some questions.
Sure.
Semi is asking, how long does vaginal rejuvenation last? Is it something you have to keep doing every few years, or is it a one-time thing?
No, it's interesting because LVR is also being used by different vaginal rejuvenation laser machines, the same name, so people get confused. This procedure is a surgery, and it's a one-time thing, and it will maintain that structures the way we leave them until as long as you decide not to have another baby or some other damage or trauma. compared to the machines, which laser machines are used in office, which is a temporarily thing. They usually last no more than a year on that effect.
So you really want to do the surgery because it lasts longer.
Right. So for the right patient, the surgery may be the better benefit, because now you not only gaining few things out of it. One is a more of a permanent approach. Second, if it's the right patient, which is in the certain age group, we can also perform the second part of the procedure if they desire so, which is comes under the designer laser vaginoplasty, which is called the DLV, and it encompasses fixing the labia if they want their essentially a labioplasty comes into it. If they want to build the hymen area back to more of a youthful appearance. Plus, we can bring the clitoris hood down a little bit. So, bottom line is, it will bring the function and the appearance back to the youth.
It's kind of like a facelift, but not your face.
Right, that's true.
And so this can also help with incontinence?
Yes. So again, that's one of the main questions we ask before going for the procedure, especially for the LVR. And at that time, we can, based on Dr. Matlock's special technique, we can do this to help with the stress incontinence. So that's to be important to understand. The stress incontinence is the urine leakage when you cough, sneeze, jump on trampoline and stuff. So that we can fix that. And that's something will stay with you for a very long time.
I mean, that seems like, an important medical procedure to have, get rid of incontinence. But this isn't covered by insurance.
Right. Because, again, we doing this procedure obviously for cosmetic reasons, just like any other cosmetic procedure, for example, breast augmentation or liposuction. So that's one of the reasons not get covered. But if patient has a complaint and we are there, and with this technique of Dr. Matlock, we can fix both areas at the same time.
Stephanie's asking, what is recovery like? But can we kind of go through, do you do this in the hospital? Do you do it here at your office?
So I like to do this either in hospital or a surgery center, depending on what patients likes to do. We can do this under journal or spinal anesthetic. Again, it's patient's choice. The procedure may last, depending on how much we have to do, from 1 hour to hour and a half. With use of laser, it's essentially a bloodless surgery. We use laser to dissect all the tissues and then put all these muscles back together. And that you very much can go home same day. You don't need to stay in a hospital. Those stitches we use in the vaginal area they will dissolve in 4 to 5 weeks. And you can very much do every activity within 6 weeks after the procedure.
Could you go back, how soon before you can go back to work?
So it depends on your work nature. Obviously, we don't want you to be running. We don't want you to be jumping. Essentially no exercising for that time of frame. But obviously you can walk and go back to work if it's nothing you're doing to affect those stitches there.
Mm-hmm. And how safe is this procedure? Jennifer's kind of asking that.
Sure. So the procedure essentially is, have to understand the safety is very comparable to any other gynecological procedure we'll perform in the vaginal area. So, for example, putting the bladder back, or which we call in our term cystocele repair, or a rectocele repair in those lines, it comes with the same risk which general anesthesia will carry. And 1% of the population may carry the risk of bleeding and infection, which is no different than from any other surgery we will perform in our gynecological world. I have not seen anybody essentially at this point who has gone through any major complication associated with it.
So I know it's not something that women necessarily are open to talking about all the time, because, it is kind of a private matter, but it is a problem that women want fixed.
Right.
Want the most of their life.
I actually have, some patients in the past, recent past, for example, a young girl in their teens had one mismatch vulva. So she was in the swim team, and every time she go through this, you see one of the vulva was hanging outside her swimsuit. And that was really embarrassing for her, and it was hard for her to continue on the swimsuit. So this procedure, which was we essentially did in her case we did a designer laser vaginoplasty, which we make that both vulvas, which is essentially a labia minora, smaller than labia majora. And with Dr. Matlock technique, is one good thing about him, he makes sure those both vulvas become very equal and even. And no other techniques I have seen over the years has able to do that to the pin. It really make it very even.
And it's really great in Genesee County because you see this doctor maybe on TV and you're trained by him.
Right.
And so you're bringing that 90210 experience to patients here in Genesee County.
Yeah, that was the whole idea to start with, because I saw this area was lacking with this one piece of information or the service which we now able to provide right here.